Hi, everyone. Welcome to today's episode. I'm excited to be joined by Asaad Hakeem, CEO and founder of SARC MedIQ. How are you today, Asaad?
I'm doing fantastic. How about yourself, Dario?
Awesome, awesome. Now, just so everyone knows, it's 10 o'clock here on the East Coast. Asaad's on the West Coast, so it's 7 a.m. I really appreciate you taking this early morning to have this interview and share some of your experiences.
Life of a CEO.
Exactly. So let's jump in and maybe just give the audience a quick overview of your company and your core solution.
So think of our solution as an AI assistant for doctors and technologists. So anything to do with imaging, we do diagnosis automation. So we are in multiple verticals, like cardiovascular. So you're looking at the heart. The AI looks at inside the heart, what's wrong with the patient, detects diseases early, keeps the patient out of the hospitals, and keeps them healthy.
Excellent, excellent. And so, I mean, what inspired you to start up your company and to kind of go into, AI and in medical imaging?
So I've been doing AI for 25 years. Worked for companies like JD.com, building robots for the indoor shuttling. So kind of like JD is like the Amazon equivalent in China. I've worked with companies like Occupied, building underwater robotics. So healthcare is close to my heart because I saw a lot of waste, and I saw a staggering number that there's $1.2 trillion of administrative waste annually uh, in healthcare. So I thought that I could make a difference, and so that's what got me inspired. And also, my mom was misdiagnosed for her for her treatment on the legs. She has varicose veins. So I thought that this should be a solved problem. It should not be that hard, but apparently it's still a challenge if you don't have the patient history. So that's what got me started.
Excellent. And the solution, it's a combination of it's a clinical and a workflow solution combined. Is that a good way to describe it, Assad?
Yes. So few years ago, there was a big hype of big data, big data, big data, and now there's a hype of AI. So we are a marriage of both. We analyze and generate data, large quantities of data with AI, and then we do a diagnosis. So and it can't be just an AI solution. It has to be a workflow solution because you have to use that data to make your workflow efficient. So think of a sonographer spending 45 minutes to an hour in your exam room with the patient and focusing on doing so many things like what's wrong with the patient and doing a lot of measurements and clicks. So what AI does is it reduces that time to under 10 minutes. So now you can focus more on patient care. And we also level the playing field, right? You're doing this in a high volume location where you have great readers versus you're in Africa and you have not so great readers. The AI is a hive mind. So it's going to detect whether you are in Africa or in New York.
Excellent, excellent. So you mentioned data, and obviously AI, healthcare, and data raise probably some concerns. How have you sort of managed that? I mean, obviously there are a lot of sensitivities around, data privacy, different regulations, integration challenges, especially in healthcare. But how have, what ones maybe have you seen, and how have you managed through those types of situations in this industry?
I mean, it's very regulated. So you go through the full compliance stack, your SOC2, your high trust, HIPAA, all those things. So the government and HIPAA and the FDA has clear regulations that we strictly follow. So it becomes easier to manage and do things right if you are fully compliant and if you have the right protocols.
So obviously, if you're bringing a healthcare AI company to market, you really have to have that understanding of the regulations and the standards going into it, I would think.
Yep. So we have in-house experts. We hire consultants to do it right.
And what about the clinicians that are actually using the application? Have they expressed any concerns, trepidation? Are they excited about it? Are they resistant to it? What's been your experience?
Oh, so they're most excited about it. They are initially skeptical, but once they develop trust, so we call it, hey, you're hiring another clinician or you're hiring another assistant for yourself. So you first evaluate that assistant for a few weeks, for a few months. Once you get comfortable with it, then it becomes part of your workflow. So it's that mindset that we have gone in, and we've been successful in delivering results.
And are you selling into healthcare organizations, physician practices? Who are your customers? And
So our major market segment is small to mid-sized market, the underserved community. Why? Because no one is going there, and they are the ones who are struggling the most, and that's where the help is needed the most. And so we are targeting over there. It's harder to go over there. First, usually you go top down, you get your few lighthouses so that the revenue is coming in. But I believe that if we don't serve the underserved, we will never serve the underserved.
so it's interesting because it's almost like, I mean, they're underserved, and what your solution does, it really brings leverage to them, right? I mean, it gives them new and more capabilities to scale the limited talent that they already have, I would think.
Absolutely, yeah. So you the most sick people are in the most underserved community, not because they have the worst health metrics, it's underdiagnosed. And so what we are doing is we are doing early detection and preventive diagnosis. So treatment is done early so that it doesn't become chronic. It keeps them out of the hospital, so it puts a less of a burden on the federal health system that is mandated to provide healthcare for the underserved to
Excellent.
everyone.
And is your primary focus cardiology, or what other sort of maybe therapeutic areas do you? I could certainly see cardiology in underserved areas, and all, that makes a ton of sense. What are the other therapeutic areas that you serve, if any?
So cardiology is the number one chronic reason for patient death, according to statistics. And then we went down the list of what are the other areas. So we are building a robust solution for OBGYN, so women's health, child care, and all the AI components according to that. So we are getting there, and then orthopedics. Everyone breaks bones. Everyone has children. How many people have been to the ER urgent care with the broken bone? So we are working in that area as well.
Gotcha. So again, it can take whatever imaging data comes out of an MRI or a CT scan or something like that, and then it analyzes it, and that's what it does, Akeem, or Hassad, and it helps to enhance the diagnosis. Is that sort of the gist of it?
Yeah, so right now it's ultrasound. We are working towards MRI analysis. We think of us as a platform play where all the key AI vendors can come in and accelerate the adoption. And so with the third-party vendors, yes, we have MRI, we have CT solutions, but our solution is primarily focused on ultrasounds and X-rays.
Gotcha. Gotcha. Excellent. And I think I read that you're currently serving over 1,500 physicians across 300 healthcare facilities.
Mhm.
What was kind of like your breakthrough moment or strategy that helped you scale from that initial pilot deployment to much more wide-scale clinical adoption?
So the strategy was working with the manufacturers and vendors, so GE, Philips, Siemens, and their staff, because everyone needs hardware, but the software that goes with that hardware is very expensive, even for these vendors. That's why the underserved community had a gap, and so we partnered with them so that they can go and sell their hardware much more complacently and much more confidently because the software actually works. And they were looking for solutions. There were some competition in there, but we are the ones who are customer obsessed rather than competition obsessed. So if we are customer obsessed and serving the underserved community, that really rose the product market fit, and we are continuously learning. We are never stopping. We are ever evolving.
That's a great strategy. Did you have to raise capital along the way?
It's a bootstrap. The capital was raised by people who believe in the software. These are doctors, high net worth angels, who are in the health care system. And so, yeah, we bootstrapped, and we never had to go the VC route.
Wow. Well, that saves you a ton of time. It's that's like
I've tried it, but I found out that I mean, I would lie to you. I mean, it was enticing that having expertise and institutional is always great, but I found out that their vision was much more aligned towards how to grow the company the fastest and probably cut some corners. I don't cut corners.
Yeah, yeah. So again, I know a number of my viewers are, they're brilliant, they're MDs, they're PhDs, but they're typically not sales and marketing people, and they
Hmm.
often have a number of questions around go-to-market models. I loved sort of the what you shared about, working through the manufacturers, but do you have any other sort of insight into, optimizing go-to-market within your experience?
So we got some external consulting companies to initially bootstrap our lead generation campaigns. Eventually, we got enough learning in-house to start growing, and then once it started generating some good leads, then we hired someone who knows how to do this at scale. And so we were happy to onboard someone who has had multiple unicorn exits. And so with that, the acceleration became very apparent. So hiring the right people and using the right tooling is probably your best bet to have a go-to-market strategy that is cold, not warm.
Yeah, and I imagine once you get some success under your belt, then word spreads. And again, like given the market that you serve, which is somewhat of a niche market, right? I mean, you're not trying to necessarily go after the biggest elephants in the room, but you're going after, the underserved, where there is probably a much higher maybe appreciation, right? They're getting pitched less, and as a result of that, they maybe understand the value better.
Absolutely, yeah. So everyone in the underserved community is the primary focus is does it work and is it affordable? And we check those boxes out. And so you need to build it right. So I kind of call ourselves as a Netflix model, business model. So pay as you go, and it's not use it or lose it, which is
Aha.
what others offer.
That's another interesting point, because the second sort of big area that I always get, and I review a lot of VC pitch decks, it's pricing strategy, right? And again, this is so new, but what I love about what you just said was you make it easy for the customer to buy from you, right? You have to reduce the risk from their perspective, both the clinical risk and the financial risk, I imagine.
Absolutely, yeah. So when we come in, and I heard Jensen Huang mention some quote that was fantastic. It's like even if our competition offers the solution for $0, there's no cost to it. The value that we are adding is net positive. So it has to be value based. It doesn't have to be a cost based structuring. So the way we value it is um, it's more accurate. So your billing gets fully corrected.
Yep.
So you're not starving over there because you're billing right, you're providing enough evidence, and you're doing the right things. If it's not required, don't do it. And so the AI helps in structuring that. Then we are making it more efficient, which makes the cost go down because instead of spending 8 to 10 hours and being there overtime, you're spending 4 to 5 hours to complete your job as a technologist, as a clinician. And so see, you can see extra patients if you want to, so it pays for itself and then some. And
Excellent.
if you have that business model, that's where everyone is like, it's a no-brainer. Why have I not heard of you?
Yeah. So you can build a really compelling business case that is simple enough for anybody to understand, basically, given the economics of the industry.
Correct.
Great, great. This has been really, really insightful, Asad. So just kind of in wrapping up, what are maybe two or three key learnings that you could share with other healthcare AI CEOs?
Be customer obsessed. Build it working with the customer and the user, because if it's not useful for them and if it's not adding value, uh, it, these guys are so busy that they're gonna get frustrated and not use the system, and then you've wasted years of your life.
Yep. Excellent, excellent. Well, this has just been incredibly insightful, and just it's really exciting to hear about your success. And I can tell you made a lot of great decisions along the way. So congratulations, and I wish you all the best of success going forward. Thank you so much.
Thank you, Dario. And I've made more mistakes than right decisions, but not too many to fall down completely. But yeah, being resilient is one of the lessons learned. So thank you for having me. A pleasure talking to you. And good luck, everyone else.
Thank you.